Hello again, Dr. Sam Gaston here with North Texas Sport and Spine, continuing with the fourth video of our September of Sciatica series. First video, we talked about what sciatica was and detailed some information about the sciatic nerve itself. Second video, we talked about some of the causes of sciatica. Third video, we talked about things you could do at home. And now in the fourth video, we'll talk about what you could expect if everything else that you've tried so far failed and it was time for you to go see a chiropractor. So to begin with, first thing, one of the most important parts, we have to do a thorough physical exam. As we detailed in the second video, there's multiple different conditions that can cause that sciatic pain. So we need to figure out which one is the main culprit. So definitely need to do orthopedic test, do some muscle testing, make sure there isn't any neurologic weakness. And the exam really is going to guide us in a couple different directions. One, if all the orthopedic tests are coming back positive and the person is really in a lot of acute pain, we're probably going to start looking toward imaging. So X-ray is always going to come first, even though MRI is going to be more the definitive factor when we're trying to rule out bulging discs, herniated discs, pressure on the nerve itself. So those are a couple routes that we could go, but say we do the exam, everything is coming up okay. We still know that there is that sciatic pain there, but we're not getting any of the major red flags that make us super concerned for wanting to refer out or look at imaging. What are we going to do next? Well, to start out with, we're going to definitely start with some soft tissue work. As I detailed in the third video, some of the stuff you can do at home, stretching is a big component of that, but sometimes it can be so painful that you're not able to do much stretching on your own, and it can be necessary for somebody to do that stretching for you. So that's definitely something we would want to take into consideration with our treatment plan. Doing some stretching, trying to mobilize that piriformis in case it is a condition of piriformis syndrome. And then other things that we might do would be decompression, some flexion distraction on the table to try to take some of the pressure off of the actual joint and discs of the spine. And then some other soft tissue techniques, potentially dry needling into the piriformis, making sure that we avoid that middle section where that sciatic nerve may be, because when you're already having sciatic symptoms, the last thing we want is to hit that nerve with a needle and increase those symptoms. So dry needling can definitely be an important part of it, but in a conservative manner. Might do some electrical muscle stim to try to get those muscles to calm down some, get the pain under a little bit of control, and then we'll shift into the chiropractic adjustment itself. In a lot of these cases, something is not moving the way it's supposed to. We've got a restriction back there, which could be part of what's causing that extra pressure there. So we want to get some motion into the spine there, especially to try to get that moving, just to help ease up some of the tension back there. And it can have some pain relief effects as well. And then after that, once the pain level gets down into controllable level and we can move better on our own without too much pain, we want to start doing some exercise, some strengthening to finish out that program, because regardless of whatever caused the sciatic condition in the first place, getting that area stronger so that you can prevent it from happening again is always going to be an important part of it. So that's going to wrap up our September of Sciatica video series. If you have any questions, feel free to reach out, or if this has enlightened you with some of the information on some of the conditions you might have been dealing with, reach out and maybe we can take a look at it and try to get you feeling better.